Coming up on American Medicine Today, breast cancer is diagnosed in over 264,000 people each year, but there may be hope for some. Dr. Nora Disis tells us how her team has developed a vaccine that could fight off one of the rarer forms of the disease. Then, Captain Mike tells us how a motorcycle accident led to severe pain, making it nearly impossible to stand while on his boat. After trying multiple spine injections with no relief, he sought out the Bonati Spine Institute and is happy to be back on the water, pain-free. Finally, Dr. Bonati highlights some of the greatest advantages of the Bonati Spine Procedures versus traditional spine surgery. What has his decades of experience treating thousands of spines proven about the medical industry? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. So an experimental vaccine has been shown to safely generate a strong immune response in treating particularly aggressive forms of breast cancer. Joining us to discuss is Dr. Nora Disis, Director of the Cancer Vaccine Institute and lead author of the vaccine study. Thank you for being with us, Dr. Disis.
You're welcome.
So why don't you first tell us about this development of the experimental vaccine and how did it come about and really how does it work?
The vaccine is targeting immunity to a protein called HER2/neu. This protein is extremely important in about 30% of breast cancers where it becomes highly overexpressed, and it's really part of the driving force of the disease. We've been studying how to immunize against HER2/neu for many, many years. But recently, new vaccine technologies such as mRNA and DNA really have made immunization much more effective in patients. So we encoded the intercellular domain of HER2/neu, which is much more immunogenic than the extracellular domain of HER2/neu, into a plasmid DNA. And we immunized patients with that DNA vaccine. And literally, it works like a regular vaccine. You immunize patients in the arm, the DNA gets into the skin cells in the arm, makes the protein in a very immunogenic way that stimulates the immune system, and patients make immunity to HER2/neu.
Do you think people are going to be hesitant to take a vaccine because of all the stuff that was going on? Even just the word vaccine, does it act like a true vaccine?
That's a good question, but I think you have to understand that not only do I have the word vaccine, but I have the word cancer.
Right.
And telling people that this vaccine may prevent their cancer from coming back, or we're working on vaccines to even prevent cancer, that is a whole new ballgame because most people see cancer as a death sentence. So we have not had anyone have any hesitation whatsoever. Of course, most of our early phase trials are in patients with very advanced disease, and they're just doing everything they can to live. Mm-hmm. But I've talked to my colleagues in the area too, and none of us have seen any vaccine hesitation for cancer vaccines.
And have there been any negative side effects? Because we know even with chemo, it's supposed to be killing off the bad cells, but it does take some of the good, and there's hair loss, different things like that. Any potential side effects with this vaccine?
That's what the beauty of the immune system is. The immune system is very specific. So immune responses are targeted directly to these abnormal proteins that are expressed in cancer. There have been many studies, cancer vaccines have been around for quite some time, looking at all the potential side effects. And the side effects are really very similar to what you see with the COVID vaccine: redness and swelling in the arm, flu-like syndrome for 2 days or 3 days, which is an indication that your immune response is revving up. Some fevers and chills, maybe a little nausea. So again, when you compare these side effects, which are generally very mild, with what patients have undergone with chemotherapy, people rather enjoy the break from chemotherapy that they're getting with vaccine treatment.
And is this to work in conjunction with either immunotherapy or chemotherapy?
Yes, in fact, now that we have vaccines that reproducibly generate high levels of immunity in most patients, we're beginning to use them in combination with immune therapy and with chemotherapy. And in fact, studies in different animal models have shown that giving a vaccine that generates high levels of inflammatory T cells that are capable of killing the tumor actually can help chemotherapy work better.
Really?
Would this only work with aggressive breast cancer, or do you think it would have any effect on other aggressive cancers?
Well, I think vaccines in general have three major uses. The use that they'll be approved for soon will be prevention of disease recurrence. And in many common solid tumors, breast cancer, colon cancer, ovarian cancer, we can treat your tumor and make it go away with surgery, chemotherapy, radiation, but the risk of relapse can be very high. And that's where the immune system works better, when the disease burden is low. The second place you're going to see vaccines approved are in actual treatment of established disease. You probably have heard about some of the vaccines that are targeting mutations that are showing some promise. And many of those are being teamed up with immune checkpoint inhibitors. So people are coming up with combination therapies focused on really giving the immune system a big boost to treat established cancers and make them shrink. The place where we're putting a lot of effort is in developing vaccines to prevent cancer. So these would be given to people with, gene mutation syndromes or different lesions that are not cancer, but really predispose them to develop cancer to prevent them from developing cancer. And this is a new area with a lot of interest where there are already clinical trials.
How many vaccines does one have to take to start and get a response? Is it one? Are you saying it's a series?
It's a series. So you're immunizing against really yourself, because cancer is ourself. So many of the immunogenic proteins are not foreign. So the immune system isn't launching a major attack. So it might take 1, 2, or 3 immunizations to do what's called prime the immune system. So get the immune response up to a certain level. And then after that, you will definitely need periodic boosters. Booster makes a difference. It makes the immune system, the immune response go higher. And in many people, if they haven't gotten an immune response yet, they'll be put over the edge with the booster.
Now, Dr. Disis, is the idea looking ahead that maybe it'll be like a regular, how we normally think of vaccines, where everyone will get a shot 10, 20, 30, 50 years in the future, where people won't have to worry about getting cancer at all? Is that the idea?
That's the idea. And I think that the therapeutic vaccines, the ones that prevent disease relapse or treat disease, I think we'll see several of them approved in the next 5 to 8 years. For the prevention vaccines, I think initially we're really focusing on people where we know they have a high risk, because we'll have to do trials to prove that the vaccines that are being developed lower their risk and prevent them from getting cancer. If we have a few wins there over the next decade, then we can start thinking about vaccines for everyone.
Well, this can certainly be a game changer in treating aggressive forms of breast cancer. Thank you so much for being on the program, Dr. Nora Disis.
Thanks, doctor.
Thank you.
Take great care. Make sure you stay tuned. Coming up after the break, a story of recovery.
I went to Dr. Bonati and he went ahead and looked at my pictures. He told me, you have pain here, you have pain here. And I was like, yeah, absolutely. I'd been to others, But he was a doctor that didn't want to fillet my back open like a fish and do like open spine surgery, because everybody else wanted to do that and I was not having it. The anesthesiologist who was working with me, I was like having a conversation with this guy, and then I was watching on the monitor as Dr. Bonati is fixing my back. I really felt like I was in good hands.
Visit AskBonati.com. Mike Howard has devoted more than half his life to the service of his country and the citizens of Florida.
I am a 20-year military veteran and a 20-year police officer here locally. Now I'm retired and a full-time captain here in the Homosassa area. I have a charter boat where we take people scalloping, fishing, scuba diving, play with the manatees, full-service charters business.
As people age, they begin to experience occasional back pain. But after a driver T-boned Mike while on duty, his occasional pain became more noticeable. And though he has since retired, life on the water was not as relaxing as expected.
Several years ago, after having a motorcycle accident, landed on my back, my back pain started to increase. I chalked it up to a little bit of old age and arthritis. After retiring from the police department and being on the boat full time, my number one concern is the safety for my clients. I noticed I was no longer able to maintain balance on the boat as I once was. The pain was excruciating at times, and I was moving much slower than I ever had before. So I started looking into what problems possibly could be, and every turn I made, it looked like we were looking at surgery.
His continual pain stopped him from enjoying the new life he so deserved.
I had a very limited movement in the lower back. The pain was very, very sharp at times. It was always there. It was a very chronic pain, but times where if I was just to bend over to hook the boat up, I would be almost literally stuck in that position for a while because it would be so painful that I wouldn't be able to stand up straight. I was unable to, a lot of times, even maintain proper balance on the boat. I caught myself at times stumbling, trying to catch my balance, and that was very unusual for me. Usually I'm pretty agile on the boat and will walk the gunwales, and I found myself more and more likely to be holding onto a railing than not. The pain I was going through really stopped a lot of my social activities. I like to get out and go dancing, and that was just not going to happen anymore. I noticed myself becoming more and more of a couch potato, and instead of being out amongst with my friends, that I just did not feel like going out and about anymore. Many of my regular activities were limited to no longer actually doing the things that guys like to do, work on stuff, from mowing the grass to weed eating to just taking care of my garden. I no longer want to do those activities because the pain was so bad.
Traditional pain management methods left his pain unresolved, so he turned to the web to look for help.
At first, I started looking into different types of techniques from chiropractic care. I did have pain management care for over a year, where we did injections into the back, even had several epidurals done. And these were just a very short temporary fix. I just could not continue just doing a drug regimen. I found out about Bonati Institute just strictly from going online. Throw in some of those Google words and start looking at different places that did advertise, that did have a lot of testimonials about them. And there was several that was interesting. Bonati's name just kept coming up over and over and over, the amount of relief people were receiving. I contacted Bonati Institute via the internet, sent them an email. I was very shocked to receive a phone call within minutes. They went over a lot of details with me, how I was feeling, what they thought they could possibly do for me. And we immediately started looking into releasing medical records. At that point, within a couple of days, I had an appointment to come down and see the staff. By that time, they also had all my medical records transferred to them. And they had a full diagnostic and workup plan all ready for me when I walked in the door. I spoke to a surgeon on the phone the day after I made my first initial contact. It was with Dr. Bonati himself, which I was very impressed with, that he would actually take the time to call me. He went over different scenarios of pain with me. And about the time he hit the fourth scenario, I said, that's it. And without even looking at an x-ray or MRI, he says, I think I know what the problem may be. And there may be more, but right now I think I can tell you what your problem is. And within a few days after he received my MRIs and x-rays, he was able to confirm exactly what his plan of action was going to be.
Upon arriving at the Bonati Spine Institute for his first appointment, Mike knew he had found the answer he had been searching for.
The day I arrived for my first consultation, I was very, very impressed, number one, with the facilities itself. My wife of 30 years is in the medical field, and she too was just very impressed by the professionalism of the staff. We went into the clinic, we sat with a nurse practitioner and went over some basic medical history. And then my surgeon came in to see me. Certainly his knowledge of what needed to be done was beyond belief. He went over step by step, vertebrae by vertebrae, what they thought was wrong and what type of relief I could expect.
Using conscious IV sedation to pinpoint and eliminate his pain, the only problem he had after surgery was remembering to take it easy.
Within about 4 days after my initial visit, I received a phone call to tell me that I was on surgery schedule to come in for my first procedure. Lumbar number 4 and 5 were the targeted areas at that time. And it was the first time I've ever had surgery where I was awake during the surgery procedure, which was a little strange to say the least. But it was fully explained to me that I needed to help guide the doctor's hands to the right places. And by watching a monitor, by knowing what to expect, the surgeons were able to very quickly work through what they found to be a problem in that area. Within a few minutes of surgery being over with, I was totally amazed that I was actually standing up. I've had a couple other surgeries before, and where you're groggy and you're immediately in bed, certainly for 24 hours, you don't want to budge. I was ready to get up and go someplace. And matter of fact, I had to be pretty much held into our room to keep me from roaming around, because I immediately thought, wow, I'm fixed.
Now Captain Mike is back on the water and back to life.
As many people, I believe, that have undergone any type of spinal surgery, I have to admit I was very apprehensive. I come from the old school. I remember when people were literally cut from the top of their back down to the bottom. I can remember seeing people after surgery wearing a very hard shell, clamshell type of brace. I did not want that. There was no way was I going to live life like that. When the surgery was explained to me that it was through a small opening and instruments were fed through a small opening, and only a certain number of vertebrae were worked on at the time, and that I would immediately go to a hotel room that night and not be expected to really have a whole lot of restrictions beyond normal. I could not believe it. And after the first procedure, I could not believe that so much work could be done through such a small hole in my back. I was amazed. I'm back out on my boat again, fishing. I'm actually do spend a little bit of time on my tractor, doing a little mowing, a little plowing every once in a while. I have my life back again. And to me, that's worth everything. I cannot brag about them enough. Again, they gave me back a style of life that I love. And what's not to love but being out here on the water every single day of my life. We have a lot of fishing tournaments coming up in the near future. And although for the last couple of years I've had to take a break from many of my fishing tournaments, I'm certainly looking forward to being back out there amongst the competition. competitors better beware. Captain Mike is back on the water.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail.
Welcome back to American Medicine Today. So, Dr. Bonati, how is it and why is it people are coming into the Bonati Spine Institute? What are their ailments when they come to see you?
Almost 2,000 patients every month that they are seeking our help.
Yes.
And then we select a number of those ones that they are usually the ones that I feel that they are the worst.
Okay.
And the situation is amazing because the results that we have, they are very unique. What makes those results to be different than what is in the market of spine surgery today?
And what are those things?
One is the physiopathology of the injury needs to be understood and what type of the area is affected and what specific nerve is the one that is creating the pathology.
Because so many doctors people go to only look and they go, you have knee pain? Okay, let's do knee replacement surgery.
When you understand the specific nerve and the pathology, the rest of the things is just surgical knowledge.
All right.
And I refuse to treat people unless I understand really that I am going to help. Great majority of the individuals that they come to us, they have several surgeries or at least one surgery before they come to us.
Right, before they find you.
And when I look at these patients, I never understand why the surgical procedure was exercised when the patient and the nerve is telling you exactly what the problem is and why they were addressed properly.
Poor diagnosis, it sounds like.
I don't know if it's poor diagnosis, but why are you going to open the abdomen to mobilize the intestines from the cavity to be able to reach the spine from the front when the pathology is posterior?
Correct.
And when the problem that you are going to address not only is going to be against your results, because the patient is not going to recover well if you open the abdomen.
Sure.
Plus, you need to have a general surgeon around there.
Do you think that that's because it's a push by insurance companies, having these other surgeons on the side, that it's more billable at that point? And it's not really for the betterment of the patient?
I really think it's a combination of everything you say.
Okay.
I really think the surgeon honestly doesn't know how to correct the problem, and he or she feel that they need to address the nerve from the front, so they don't need to intrude the spinal cord on the back.
But wouldn't a direct approach be better?
Yeah, but the direct approach also has consequences. If you go in the direct approach and you damage the spinal cord, you have paralysis. Or you cut the nerve, you have paralysis.
Right.
So going from the front is a little bit less risky because you can see more, number one.
But can't you possibly cause more damage to all the internal organs you're touching at that point?
If you have a good general surgeon, the manipulation of the organs is not a really major problem.
Okay.
The combination of those surgeries, they are practically a result of a bad treatment to the doctors by the insurance companies.
Right.
When the insurance companies start to cut the physician to be properly reimbursed and properly treated like a doctor. That's why these guys went for years and years of training.
Right.
You're not talking about somebody who has 6 months of training. When you do a spinal surgery and an insurance company wants to pay you $3,000 per surgery, you understand that risk that doctor is taking for $3,000 is like a joke.
Besides just the moving of organs, I'm assuming because it is so highly invasive that they're putting the patient under general anesthesia. And we all have heard the horror stories of people going in even for sedation dentistry and dying.
If you need to put the patient to operate the abdomen, you need to have general anesthesia. When you need to do general anesthesia, the patient and then operate that patient, the surgery, instead to be an hour surgery, is 8-hour surgery. Correct. The recovery of that patient is not one day. The recovery of that patient 6 months to a year.
Yeah.
Once you recover the patient for a year with physical therapy and all these treatments that they need to be done from pain medications and all this, that patient is practically an institutional patient. Because now he's going to be going to a doctor in and out and in and out. And the next thing that happens with this individual, he's not going to go back to work.
Monumental.
And when you don't allow the physician to be compensated for what the doctor does, the doctor is going to invent another thing. And this is what is happening today in the market. If you go and you look at the journals of orthopedic surgery or the journals of neurosurgery or spine surgery.
What do you find?
Every single day you talk about fusion.
Yes.
And every single day is a new fusion with a new procedure, with a new screw. Well, what they do is they try to compensate the payments for a surgery that will be probably a little bit more better pay. Right. And when that happens, the only one who suffers is the patient.
And that's what you do so differently at the Bonati Spine Institute. You don't put people under general anesthesia. And the fact that you don't use fusions. You're able to treat everyone with your exclusive patented Bonati Spine procedures without introducing those torture devices. That's the reason that people are coming in with all their ailments to be treated by you at the Bonati Spine Institute. If you would like to find out if you're a candidate for the exclusive Bonati Spine procedures, visit AskBonati.com. And to watch any previous episode of American Medicine Today, check out Rumble. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you. And to catch previous episodes of American Medicine Today, search the Bonati Spine Institute on YouTube and Rumble.